Good evening, guys. I have discussion D for you. We are discussing medications that can cause memory loss. Okay, so here we go with the presentation I made for you. Please sit back and enjoy. Okay, medications that can cause memory loss. Memory problems can emerge quietly. A misplaced appointment, a name that won't come, a fog that settles over, tasks that once felt effortless, while aging, stress, and illness can all play a role. Medications are an often overlooked contributor. Many commonly prescribed drugs influence the brain's chemical messengers, sleep cycles, or blood flow, and even small shifts in these systems can affect how clearly we think or how well we form new memories. If you've noticed new forgetfulness, slow thinking, or difficulty concentrating after starting or adjusting a medication, it's important to bring this up with your clinician. Never stop a medication abruptly. Many drug-related cognitive effects improve with dose adjustments, timing changes, or safer alternatives. 7 common medication classes linked to memory problems. 1. Benzodiazepines. Examples: lorazepam, Ativan, uh, all, prazolapam, Xanax, diazepam. Value: these medications enhance GABA, the brain's primary inhibitor, inhibitor, inhibitory neurotransmitter. Well, this calms anxiety or helps with sleep. It also dampens the brain's ability to form new memories and sustain attention. Short-term memory gaps are common, and long-term use has been associated with persistent cognitive decline in some studies. Their effects can be especially pronounced in older adults whose brains are more sensitive to sedatives. Anticholinergics. Examples: diphenhydramine, Benadryl, antidepressants. These drugs block acetylcholine, a neurotransmitter essential for learning, memory, and attention. When acetylcholine levels drop, people may experience confusion, slowed thinking, or dementia like symptoms. The anticholinergic symptoms, the burden can accumulate across multiple medications, even over the counter allergy or sleep aids. Making this class particularly risky for older adults. Anti-seizure medication, anticonvulsants, convulsants medications. Example: Topamax, carbamazepine, Tegatol. By designing these medications, reduce excessive brain activity, but at the same time, but that same calming effect can slow cognitive processing, impair concentration, and make it harder to encode new information. Some people adapt over time, others may need a different medication or dose to reduce cognitive side effects. Let's see. Opioids, narcotic painkillers. Example: oxycodone, hydrocodone, and morphine. Opioids affect the hippocampus, the brain's memory center, and alter sleep architecture, especially the deep sleep stages needed for memory consolidation. People may experience clouded thinking, slowed reaction time, or short-term memory gaps. These effects intensify with higher doses or when opioids are combined with other sedatives. Prescription sleep aids, Z drugs, and sedative hypnotics. Examples: zolpidem, Ambien, Lunesta. These medications can cause arterial grade amnesia, meaning difficulty forming new memories after taking the drug next day. Grogginess, slowed thinking, and increased fall risk are also common, particularly in older adults. Even when sleep improves, cognitive clarity may not. Statins, rare cognitive effects. Examples: atorvastatin, Lipitor. Most people take statins without cognitive issues, but some report reversible memory lapses or confusion shortly after starting therapy. Research is mixed, and the cardiovascular benefits of statins are substantial. Still, if memory changes appear soon after initiation, clinicians may consider dose adjustments or switching to a different statin. Chemotherapy and other systemic agents. Example: methotrexate, certain targeted cancer therapies. Chemobrain is well documented phenomenon involving memory lapses, slowed thinking, and difficulty multitasking. These cognitive changes stem from inflammation, immune activation, and direct effects of treatment on the brain. Symptoms may fluctuate and can persist for months after treatment ends. How to reduce risk and manage symptoms. Do not stop medications on your own. Sudden withdrawals can be dangerous. Always consult your prescriber. Review your full medication list. Ask a clinician or pharmacist to evaluate for anticholinergic load, sedating combinations, or unnecessary duplicates, especially if you're taking multiple medications for sleep, allergies, bladder issues, or mood. Explore alternatives. Options may include non-sedating antihistamines, SSRIs, instead of tricyclics, or behavioral therapies for insomnia and anxiety. Support brain health. Adequate sleep, hydration, nutrition, and physical activity all strengthen cognitive resilience and can reduce the impact of medication related fog. When to seek urgent care. Seek immediate medical attention if memory loss is sudden or accompanied by severe confusion, weakness or numbness, slurred speech. loss of consciousness, dramatic changes in behavior or alertness. These symptoms can signal a stroke, overdose, or other medical emergencies. For gradual or milder changes, schedule a timely visit with your clinician to evaluate reversible causes such as thyroid disorders, vitamin B12 deficiency, infections, depression, or medication interactions. These drugs can cause memory loss. Many commonly used medications can cause forgetfulness, confusion, or trouble forming new memories. Effects are usually reversible after stopping or changing the drug, but older adults and people taking multiple medications are at higher risk. Common drug classes and what they do. Benzodiazepines, example, Ativan, Xanax, Valium, affect, impair formation of new memories and slow thinking. Long-term use is linked to persistent cognitive decline in some studies. Anticholinergics, example, diphenhydramine, Benadryl, oxybutynin, some tricyclic antidepressants, effect, block acetylcholine, a neurotransmitter essential for memory and attention, can cause confusion, word finding problems, and slowed recall. Older adults, especially sensitive to that condition. Anti-seizure medications, example, Topamax, reduce neuronal excitability to prevent seizures, but can also blunt concentration and short-term recall. Dose and combinations matter. Opioids, example, oxycodone, hydrocodone, and morphine alter hippocampal function and sleep architecture, which impairs memory, consolidation, and attention. Okay, guys, that's your D for today. I will see everybody later or tomorrow for shows. For now, Gator Wellness, take care, folks.